when sharing patient data, what are the regulatory guidelines we should follow? And can we discuss best practices for de-identifying data to protect patient privacy?
Well, if I may, thank you for the question. Let me show some, like, I'm really eager to show you some pictures. So if you don't mind, I'm gonna share my screen
Okay.
and let me explain what those images are. So on the left, it's actually an X-ray. And usually it's a so-called format DICOM, which actually has pixel data and meta tags. But most importantly, for a lot of medical images, what we have is so-called burnt-in information. As you can
Mhm.
notice, there's actually a name of the patient, date of study, and date of birth right as part of the image. So it's actually very important to root it out. So here, you actually have to flip the pixels to make sure that nobody can hack into this image and attribute this image to Douglas Davidson. By the way, this is pseudo PHI. It was created by NIH to demonstrate pseudo PHI. So don't worry, we're not showing anything particularly sensitive. But once it's done, then you can actually use this semi-upright portable L, all this very important information for research, while still it's not attributable to any particular patient. So that's one example. Another example is meta tags, or could be any tag. So for example, here we have information about the patient, date of study date, acquisition date, content date, etc. But also we have hospital name and name of the referring physician. And going back to what we discussed before, sometimes hospital name is enough to identify a particular patient, especially if it's a rare disease or unusual situation, like Nikki, you encountered. So it's very important to de-identify this information. And once again, what do we mean by de-identification is not have the dates, not have the hospital information. And actually, quite often we have things like study description, where it will have both very important for research information and the names and other sensitive information which needs to be removed. So that's another example. Another example would be, this is for medical images. I won't show text because we're all familiar with the text and identification. But if we're talking about videos, so here's the video for colonoscopy, right? So we have the faces of the assistant, of the main physician, probably a student physician, as well as the patient. All of this information will actually identify the patient, right? Because facial recognition is very good right now. So it's very important if one wants to, let's say, share this image for research, to obfuscate things like faces, but also you see how nicely all of the sensitive information is right there on the screen. So this information has to be de-identified. Sometimes the patient tag might have some sensitive information, etc. But you see how what we're discussing by de-identification is, how do we make it so that the image is still usable, but at the same time it doesn't lead to any particular patient? That's the goal. Because then, to other speakers' point, then it becomes not very interesting for the bad guys. There's not much you can use here, right? Nothing to blackmail or lead back to the patient. So that's why, but the important thing here is each type of PHI has its own specifics. For example, if we're talking about dental x-rays, if we obfuscate teeth, can identify the person uniquely, as we know from all the CSI movies, right? But if we de-identify all the teeth, then it will be no use to dentists. So this is another one where the decision has to be made very thoughtfully, with guards and rails in place, because who should have access to the dental record and who should not.